People didn't get their stimulus a little bit malago, right? Right, Joe, sir? 709, 5th of May. Let's keep it going in the Zoom room. It's all nice and warmed up now as we get Dr. Hoa Nguyen from the Physicians Advisory Group in on the link. Good morning, Doc.
Good morning, Chris. Sorry I'm late, buddy.
No, it's okay. And there's never an issue with a politician, being on for more time. They always have a lot to say. Um, but
Hey,
Doc, I guess we'll just start here with this news of the 137th fatality, 59-year-old who was tested positive for COVID-19 upon arrival to GRMC and later passed. Do you know anything at all about the patient? And I guess the biggest question is, were they vaccinated, fully vaccinated, half vaccinated? Do you know?
yeah, any patient that admitted recently are not vaccinated. Yeah, every one of them. So that's why we truly encourage people to get vaccinated because as you have more people in the community that have been vaccinated in the past, actually your risk coming up quite a bit. So it's everyone that admitted both at GMC and at GMH are not vaccinated.
Okay, so this 137 fatality not vaccinated.
Yes.
Okay. What else can you tell us about? Do you know anything, Doc, about the underlying conditions that this patient had suffered from?
Um, I think I'm not sure this one is the one that involved also. I think it's a different. The one involved in that car accident is different, but this one I'm not quite sure if they have comorbidity, but I'm very sure that they have. It's unusual for a person that passed away. We have a few that passed away because of COVID-19 related that have no comorbidity, but overall, for the most complication they have is like hypertension, diabetes, obesity, and cholesterol and heart disease. So more likely this person will have it. I don't know the detail of it, but it's pretty young to be passing away suddenly.
What did you say, Doc, about a car accident victim and COVID? What?
I think there's one instance that is the car accident. We're not quite sure if the patient has hypoxia from COVID or from other comorbidity that makes them probably pass out. But I'm not quite sure if that one. I think I'm still not still here with us. But that's been. I think that's a few days ago. But again, that's something that we cannot discuss much because of HIPAA.
Right.
So
Yeah.
uh,
Well, let
answer
me
that.
just ask then. This person was in an accident. Was it a fatality?
No, it's not
Okay.
fatality.
Okay. And so you guys aren't sure. Did they test positive for COVID?
Yes.
Okay.
The case that we are positive in the hospital are accidental. They come in there for surgery or
Right.
they come in there for, and before they do that, we have to test them.
Yeah.
And if they test positive, the question is that, hey, is that COVID related hospitalization or not? Just because, the question that they have for a long time, or because remember, you can test positive up to 3 months, if you pop the pass.
Right. And so this person that was involved in this accident, what did you say? Hypoxia? What is that in English?
Hypoxia, remember, COVID-19 have caused for the silent hypoxia. And that means that you drop your oxygen so low that you don't know about it until it really hits you and it becomes symptomatic. That's why we encourage people in the past that they have COVID-19 infection that's positive, that they buy a pulse oximeter to just monitor the oxygen level in the blood. Just because the oxygen can drop and your body does not respond normally to hypoxia like other disease. It will hit you and suddenly you have shortness of breath and you down in the 80% already in your oxygen.
Interesting.
Yeah. So silent hypoxia is something that we're looking for in patients that turned positive for the COVID-19.
Wow. Doc, what about these 15 more positive cases from a batch of 572 tests run on Monday? One reported recent travel, one is identified in quarantine. 5 were
Yeah,
identified through contact tracing. 15 positives. I see a number like 15 in a time like this, and it really sticks out.
yeah. As we open more, we released more restriction in the past, right? You're going to see a lot of people out there in the community going to gather a whole lot. So we expect fully that the positive will go up. Um, but the key here is that as you have more people immunized, the CAR score or the positivity rate in the community will probably grow a bit larger, but the hospital admission hopefully will stay down. And that's the purpose of the vaccine, is that if you have the virus, you're not that sick. That the severity of the virus that caused illness in the past is much, much less severe, that you don't end up in the hospital. Again, in order for us to keep the positive rate down, is that we encourage people that when they're sick, to not go to any gathering or not go to work, and don't mingle other people unless you get tested, and you make sure you test negative before you do that. That's the only way that we can ask community to do things like that, to kind of keep our positive rate down lower. So we have to keep reminding people about their illness.
So these 5 identified through contact tracing, do you know if it was related to any of the clusters that we've been talking about?
There's a few out there that we test positive in the clinic, Chris, that is not related to the cluster. I think the cluster, the Sobaki and the A Lounge, it passed 2 weeks and about 1 to 2 cycles already, so that cluster should be somewhat decrease or resolve quite a bit. So this is probably from any positive in the community that the public health do the contact tracing.
What about the quarantine, Doc? A lot of people are a little upset about the quarantine policy. Hasn't changed, and I understand that's because we delayed the reopening of the island because of these clusters, right? But
Yeah,
is there still discussion on, or is it just tied together that we're not going to change anything with quarantine until we reopen? What's the status?
The new quarantine guidelines have been finalized. It just depends on when the governor feel comfortable to release it. It's either on the 15th or 16th of this month, or depend how she make a decision. But when we have not in the past required any pre-arrival PCR to be implemented, just like in Hawaii. And so that's one of the new guidelines, that we're going to require that for people to come in, especially if they unvaccinated. So we do a few things that is not done in the past, just to try to mitigate any type of infection coming from traveler. So we have some new stuff that we're going to implement, try to make sure that when people come in, that they test negative before they come in.
We had a question here in the comments. Francisco writes in, ask the doc, with the population of Guam getting vaccinated, will the COVID strains become more aggressive or stronger towards those who are not vaccinated because the virus cannot find a host carrier?
Yeah, when I think that any type of new strain most likely would come from the traveler and not from local infection, because as as we have more travel coming in and out of Guam, there's a risk that you have a variants that come in, right? Just like the UK variants,
Yeah.
California variant. So it's not so much of the you have a variance from Guam, it's a variance from other people. Now, the more people get vaccinated, remember the vaccine we use right now are working on those variants. Okay, and none of those variants that they have right now, because the covariants of concern, mean that what our vaccine are working to protect you against those variants. So I think the chance that we have both variants is very rare. It's just that from other part of the country is much more prevalent, and more likely it will be here in the community. But again, that's why we hope that more people come out to vaccines so that way can protect the island.
Doc, what about other types of sick visits at the clinic level? What are you seeing?
Right now, what we've seen is a lot of non-COVID related sick visit. Again, both hospitals are pretty full on other non-COVID related admission, like heart attack, stroke, and other complications of those chronic illness, because people have been kind of put that off during the past year or so, because they either get nervous about go to a clinic because of COVID-19. So they kind of and that change their lifestyle. They stay home a lot. They're not exercising. So we see that those non-COVID related comorbidity, create quite a bit of problem with our patient right now. And I say there's quite a bit more admission, and most of the time, both the hospital are full with non-COVID related admission.
So you're seeing a lot of patients playing kind of catch up, right, with things that they maybe
Yeah.
didn't pay attention to for the last year.
Yes, a lot of people come in just to try to do their laboratory tests just because they haven't done it for about 6 months to a year already. So we really encourage patients also to make sure that I know the pandemic in the past year changed a lot of people's lifestyle, but we need to get back to somewhat a near normal lifestyle. That exercise, what will you eat, and go see a physician to make sure that whatever you have has been taken care of, and take your medication.
Right, guys. Yeah, go see your physician because the silent killer, hypertension, high blood pressure. Doc, going through this pandemic and just being stressed and having anxiety about, you could die from COVID, that wears on a person, right? Those types of situations, do they affect like the hypertension and the high blood and all that?
It does. People are afraid. They stay home a lot, and when you stay home, you become very sedentary, and that raises everything else there. Your weight go up, and everything else go up. So it's encourage people to exercise. Go walk in the park, on a paseo, or the asana. Any way you can walk out in the open environment. You can't really catch the virus or anything else from other people if you just walk in an outside environment. So I encourage people to take time to do that. Every time I pass by Asan, I see a lot of car there. I'm really happy to see that.
Yeah.
The bicyclists on the road, those things that is wonderful for us as physicians. The people are trying to be active in the lifestyle. So
Yep.
kudos on those that are trying.
Keep it up, guys. Put Dr. Hoa out of business. Get healthy.
It's okay. I'll be glad to do that.
You go fishing, right? Doc, we had a comment here. This is Rosemary's, man, this lady's on it. What is being done for those individuals where doctors advise them not to receive the vaccines because of their medical conditions? And is that a significant number of people, Doc? And if you could just go over again, like what are the medical conditions that a person might have where you would say, oh, you can't get the vaccine?
Yeah, that is very, very rare. If you have severe allergic reaction to any type of vaccine that require you to have an EpiPen administered to you, those are the patients that most likely would say, hey, you might not be able to get the vaccine. On the elderly, depend on their comorbidity. If they are really frail and have a lot of comorbidity, we rather have the people around them get vaccinated and take care of the people, because they might not handle any type of response to the vaccine. even with patients who have cancer that are on immunosuppressive medication, we still encourage to get it. They might not have the response to the vaccine as much because they've been on medication suppress immune system, but we still encourage to get them. The only thing is that the only one that I and other physician recommend not to get yet is during the early pregnancy. Like late pregnancy during third trimester is okay, but first, second trimester, I know Dr. Shea will do that too. That we encourage people just to wait until later on during the pregnancy stage to get the vaccine. But again, there's very rare case that we tell the patient not to get it. We rather protect everyone around them.
Okay. Anything in closing, Doc?
Again, just remind people, if you're sick, please
Stay
go get
home!
okay, stay home. Go get tested. Don't go to gathering. Don't go play sport. Don't go to work until you get tested have negative. So that's the only thing I can tell you, that to go forward along with the vaccine, that you will see a decrease in the positive rate in the community. So, and the other one is that vaccine is, we have a lot. There's no shortage of them. So please go out there and get to any location and get vaccinated.
What did you think, Doc, of this idea with GVB where they want to attract Americans who are living abroad to come to Guam and get the vaccine? This vaccine tourism deal. What are your thoughts on that as the PAG chair? Is that something that you think is feasible? I mean,
we don't have the shortage vaccine anymore because we have a lot. Between the current vaccine and the community health vaccine, there's a lot of vaccine. I'm not sure we can get enough vaccine on people's arms because we're going to have excess, and we don't want to return the vaccine. So a lot of expats that live in Japan and the Philippines and Thailand, everywhere, that they don't have the vaccination where they are. So GVB idea of bring those expats back to Guam and stay, just to increase our tourism economy, to help the economy of Guam. I think it's an excellent idea because the bottom line is they all are U.S. citizens. They are not foreigner. So to bring them back, and a lot of them want to come back to get the vaccine to protect themselves in those countries. So I think it's an excellent idea that they think outside the box to do that. So I would say that I would support that for them to open a program for the U.S. citizen that lives abroad, the expat to come to Guam, because that's the close point to get vaccinated.
Last question, Doc. Relative to vaccinations, the FDA, I know, has started the discussions to give vaccines to children as young as 12. Is that something that's being looked at here? Because I know right now 16 is the cutoff.
Yeah, I think by next week we should want to give vaccine to 12 years old and older. So that's something that we looking to see how the best approach to get the 12 and older to get vaccinated. There's quite a bit of them out there. So and remember, as a minor, you have to involve the parents.
Right.
So you have to kind of administer the vaccine to this minor. You have to pay attention. Hey, the parents have to work too. You can't do that in the middle of the day. The parents sometimes cannot get off work to get vaccinated. So we have to start planning to see if you have to work some type of late evening hours, so the parents will be off and to be with their minor to give consent for the vaccination. So that's something that they need to start planning and not giving the vaccine in the middle of the day, because parents cannot make it, and you cannot give the shot without the parents.
Okay. Thank you, Doc.
You're welcome, guys. Be safe and 3W always, okay?
That's it. You got it. We'll see you. 3 W's, okay? Especially graduation season. 7:29, it's Wednesday, 5th of May, 2021. Good. Go ahead.
Yeah, Dr. Nguyen was just saying, like how well stocked we are and everything, and we want to remind people, like the story we reported yesterday about the order that Gov Guam put in for the new batch
Right.
of dosage for May, I believe 33,000 in total.
Wow. And so that's why Dr. Hoa was saying that, yeah, we're not short of the vaccine. So in case you saw that and wondered if we are, I guess we aren't.
Was it